Hello friends, this is Dr. Boppana Venkata Bhargava, consultant urologist, uro-oncologist, robotic and transplant surgeon, Narayana R.N. Tagore Hospital, Mukundapur. So today we are here to address few questions which I commonly encounter in my OPD practice. So I would like to give answers to these questions which are being asked regularly to me. This will give us a health knowledge and education about how these problems have to be tackled in your daily lifestyle. So regarding the question which is being shown, so elderly gentleman above age of 60 years with lower urinary tract symptoms, if he presents to us, the first step would be to take a detailed history from the patient. So we take a detailed history about his symptoms. The second step would be to take a symptom score. So we have something called as IPSS scoring, where we score the symptoms and we grade it into mild, moderate and severe. So after taking a detailed history and making a scoring for the symptoms, the third step would be to do a physical examination. So as part of physical examination, what we do is called as a digital rectal examination, where we put our index finger into your rectum and we palpate your prostate. So based on this physical examination, we can grade the enlargement of your prostate and we can also get an idea whether the prostate is benign or it is malignant. So after these tests which are being done in your OPD, then we subject you to your urine and blood tests. So the panel of prostate profile would consist of an urine routine examination, serum PSA being a short form for prostate specific antigen, RFT, which is renal function test, which includes a serum creatinine, an ultrasound KUB, that is ultrasound of kidney, ureter and bladder with post-void residual urine, and also we would do an uroflowmetry. So the next step regarding the management would be based on the results of these tests. So this is how we proceed for a treatment of an elderly gentleman with lower urinary tract symptoms. So the treatment for lower urinary tract symptoms will be based on the cause of the disease, cause of the symptoms. If it is most probable cause would be in an elderly gentleman would be a prostate, and the treatment would consider medical management and surgical management, which will be decided on the values which we get from the investigation, also from the physical examination we do on you. So regarding the question which is frequently asked to me is what is the advantage of robotic surgery in renal cancers? So once you are diagnosed to have a kidney tumor or renal cancer, so your treatment option would depend upon the staging of the disease. If the disease is localized only to kidney, so surgery would be the first option. And in surgery, it would be based on the extent of the tumor involvement. So it can be a radical nephrectomy, where we remove the entire kidney, or a partial nephrectomy, where we preserve the kidney with removing only the tumor. So the option available for these two surgeries are open, laparoscopic and robotic. So what are the advantages of robotic which goes over open and lap? The first thing is there is a surgeon parameter and also there is a patient parameter. Regarding the surgeon parameter, the surgeon will sit in the console and will operate via the robotic arms which are pushed into the patient body. So the surgeon is operating sitting down, so there is comfortability of the surgeon, there is no fatigue to the surgeon. The second advantage is the surgeon gets a 3D view of the image in his console. So 3D view will increase your depth perception of the tumor, so the tumor clearance would be easier and better. The third thing is articulation of the robotic arms. Your human hand can only move up to a particular degree, but the robotic arm can move full 360-degree. So even the minute spaces where the human arm cannot penetrate, the robotic arm can penetrate into those spaces, and the finesse of the surgery is way better. The next thing is the magnification. The normal magnification which you see with your naked eye is 1x, but in the robotic console we get a magnification of 10x. So the details of the tumor and the normal kidney is way enhanced than the normal eye. So your finesse of the surgery and the results of surgery are excellent with robotic surgery. These are surgeon parameters. Regarding the patient parameters, the blood loss. The blood loss is minimized because you have an enhanced vision, 3D vision, and articulation of the arm is 360. So the need of blood transfusion is very much minimized. The next thing is the post-op recovery. Since we are doing a keyhole surgery or a micro surgery, the wound post-op is very minimal. Total wound length will be less than 1 centimeter. There will be 4 ports. So the recovery is at most speed, and patient can be the discharge in less than 24 or within 48 hours at maximum. So his return to activity is also faster. Next thing is clearance of tumor. Since we have 3D vision, 360-degree articulation, 10x magnification, the clearance of tumor is almost guaranteed. So the normal kidney can be very much preserved with removal of only the tumor. So these are all advantage of robotic surgery over conventional open or lap surgery. So the next commonly question I encounter is blood in urine. What should I do next? So whenever a gentleman is coming to you or a woman is coming to you with blood in the urine in your OPD, it is a significant symptom which you should not leave it light, because blood in urine only happens if there is any disease in your kidney, ureter, bladder, prostate or urethra. So it has to be taken seriously and it has to be evaluated. Especially blood in urine in high risk patient. What is high risk patient? Any patient above the age of 50 or 60 years, a smoker. All these patients should be taken with high risk, because blood in urine can be a symptom of an underlying cancer in the kidney, ureter, bladder or prostate. So what should we do? Whenever the patient comes with a symptom of blood in urine, first is to take a detailed history of the patient, then do the physical examination of the patient, then subject him to the blood and urine test. So what blood and urine test we subject to? So we do an urine routine to confirm there is microscopic or macroscopic hematuria. We do urine cytology to see any malignant cells in urine. Serum, PSA, prostate specific antigen to suggest any prostatic malignancy, and to do an imaging. So for macroscopic hematuria, that is, there is bleeding which is seen to the naked eye, we do something called a CT urogram. CT means computerized tomography, where we do CT scan of the kidney, ureter and bladder to see if there is underlying pathology which involves the kidney, ureter, bladder or prostate. Once we identify the cause of the bleeding, the most common causes of bleeding can be an urinary tract infection, or it can be a malignancy or cancer in the kidney, ureter, bladder or prostate, or it can also be the renal stone. Based on the cause, the treatment will be proceeding. The next common question which we see is in the pediatric age group with lower abdomen pain and lower urinary tract symptoms. How should we proceed? So children, be it male or female, can present themselves in OPD with lower abdomen pain and urinary symptoms. So the most common cause would be an urinary tract infection. So to diagnose an urinary tract infection, first after the pediatric patient comes to our OPD, we do physical examination, we take a detailed history, and then we subject them to the blood and urine test. So the urine test, which is important in diagnosing an UTI or a urinary tract infection, is urine routine, urine culture, ultrasound abdomen with pelvis, that involves kidney, ureter, and bladder screening and post-void residual urine. So based on these reports, if we diagnose there is infection in the urine, after seeing the culture report, we would start an appropriate uro-specific antibiotic and UTI would be treated. The other common causes of lower abdomen pain with urinary symptoms can be a bladder stone, ureteric stone, or a kidney stone, which should also be treated based on the stone size and the location. I hope this small educative video was useful to you. These are the commonly questions which are asked and how it has to be dealt. Stay safe, stay healthy. Any other questions or queries you have regarding urological management, then please let us know and we will get back to you. Thank you.